From an early age, I wanted to contribute to making the world a better place. I chose to study biomedical sciences with the idea of developing life-saving medicines. But things turned out differently. Carrying out animal experiments and research within the four walls of the lab did not suit me. Therefore, I went looking for another form of science with a societal mission. And that's exactly what I found at the Athena Institute, where at that time a small group of enthusiastic people was studying how science could better meet the needs of society. At that time, we focused mainly on biotechnology and small-scale agriculture in low and middle-income countries. But later we also customized our approaches to other domains, such as the health sector and the Western world. At the end of the 1990s, we observed that health research in the Netherlands was completely determined by scientists and funders. Patients played no role at all, even though they are the subject of study. As a result, research outcomes were less useful in practice. At Athena, we wanted to change this by actively involving patients and their relatives in health research. After all, they are the ones who experience the consequences on a daily basis, so they can indicate which innovations are most needed. But back then, patient participation in research hadn't been done before, so how to go about it?
The first step is to determine which issues should be studied. At the Athena Institute, we believe that this should be based on what the target group themselves consider important. An example can be found in this project, where we develop a research agenda for the Dutch Huntington Knowledge Network. This network brings together different actors to stimulate research and knowledge sharing on Huntington's disease, in order to better help people with this rare neurological disorder. By conducting interviews with people with Huntington's disease and with their families and caregivers, we identify what issues each of them finds important. They then engage with each other during a dialogue session, not only to combine and prioritize the identified issues, but also to get familiar with each other's perspectives.
Kees, we gaan het hebben over de onderzoeksagenda. En daar heb jij echt wel aan meegedaan, hè, om die te maken. Wat zijn voor jou belangrijke onderwerpen?
Nou, in eerste instantie zelfstandigheid. En ten tweede instantie dat het belangrijk is dat je als persoon gezien wordt en dat je zelf kan doen en laten wat je zelf wil.
We hebben nu die onderzoeksagenda geschreven. Hè, dus daar staan al die belangrijke onderwerpen op een rijtje. Daar gaan we meer onderzoek naar doen. Wat hoop je wat ermee gaat gebeuren?
Nou, in ieder geval uiteindelijk dat de stereotypen weggenomen gaan worden. Dat er veel meer gekeken gaat worden naar mensen zelf. En dat er veel meer mensen wordt geprobeerd gestimuleerd te worden in plaats van haast afgeruimd te worden.
This participatory approach ultimately results in a shared research agenda that reflects the perspectives of all actors. However, jointly setting a research agenda does not necessarily lead to inclusive research. To ensure that, you will also need to involve patients in its implementation.
Within the Athena Institute, I study the topic of stigma, and in my research I involve people with stigmatized conditions, for example as research assistants. They help with the design of the study and the development and implementation of interventions. During a project on leprosy in Indonesia, I worked closely with Hadi, a research assistant who had this disease himself. After a few months, he started to suffer from complications. He became very ill and eventually he passed away. On that day, a colleague called to tell me the sad news. An hour later, I was on the back of a motorbike on my way to the funeral. It was a surreal period, during which I thought a lot about what Hadi went through. Because he suffered greatly from exclusion and discrimination during his life, I started to look into how to counteract stigma even more. I discovered that not enough was known about this, and from that moment I was determined to change that. But change can only be established if you work with the target group themselves. That is why, for example, we co-created these comics in Cirebon with young people with leprosy, religious leaders, artists, and teachers. Each with a destigmatizing moral in order to open up the discussion. We also incorporated typical aspects from their culture, such as a regional dish or this billboard from a local band. As a result, readers feel the closeness of the issue and are more likely to contribute to solutions.
But how to ensure that changes are permanent and that people do not go back to old patterns? Well, to anchor interventions, you need a systems approach because it requires a change from all parties involved in the healthcare system. Researchers, policymakers, healthcare professionals, and also patients must engage in new collaborations and find ways to address the problems they encounter in the process. If one of the parties involved does not cooperate, nothing will change in the long run.
That's why we worked with patients and healthcare providers from different lines of care to improve the quality of birth care. With the help of Athena Institute researchers, we implemented new ways of working, such as intake meetings with both first and second line care providers so that the patient can discuss all their wishes in one meeting. We also improved the transfer of information during a referral so that the patient's wishes come through in the hospital properly. These working methods have changed permanently and are still used today. Partly because together with the Athena Institute we have also developed methods for healthcare providers to evaluate and improve the quality of care independently and on an ongoing basis.
It is special to look back at what we have achieved in the past 40 years. Within the health domain, Athena is a leader in the field of patient participation, and our philosophy is increasingly the norm in health research. I'm really proud of our contribution, but I also hope that we can achieve much more, because there are so many challenges. For example, in the relationship between health and sustainability, but also to keep on engaging the most vulnerable groups. The persistence of structural inequality means that we still have a long road ahead of us, where we discover something new behind every corner. Ja, ik ben. There are still so many challenges. Ik vind het niet leuk meer.
Nee, snap ik.